Pandemic preparedness is like taking out an insurance policy against future crises. But insurance comes at a cost, and all of us grapple with this. In good times, often people will say, why are we spending so much on insurance? It's so expensive. What a waste of money. But when the crisis comes, everyone says, why didn't we buy enough insurance? COVID taught us many lessons. We developed new capabilities in disease surveillance and data analytics, resource management and forward planning, vaccine logistics and supply chain operations. Unlike SARS, COVID was a prolonged pandemic. It demanded a comprehensive and integrated response across healthcare, border control, economic support, and social and education services. We had to work with business and community groups and to get everyone on board in following the SMMs. You probably have forgotten what SMMs meant or what the acronym means, Safe Management Measures. And that is where CDA comes in. CDA brings together expertise and functions that used to reside in different organizations, MOH, NCID, and the Health Promotion Board. By combining medical, policy, and operational functions under one roof, the CDA will enhance collaboration, knowledge sharing, and capability development. The CDA will complement our existing capabilities by focusing, as you heard from Vernon just now, on the early detection of threats, drive integration and coordination by refining our preparedness strategies, and make sure these plans can translate into tangible actions. First, the CDA will have to focus on deepening our international cooperation. Pandemics do not respect borders, and our efforts must be equally borderless. Memories of COVID are fading, and support for multilateralism more generally in today's fractured and contested world is weakening. Support for multilateralism in global health is also fragmenting. The reality is that this would just leave the world less prepared for the next pandemic. It's unfortunate that these are the trends we face today, but at the same time, Singapore is not helpless. We do not have to be passive bystanders. And that's why the CDA must redouble its efforts, work with like-minded partners, and there are many like-minded partners around the world, to strengthen cooperation on disease surveillance, intelligence sharing, and R&D in areas like vaccines. Second, the CDA will take the lead to refresh and update our national pandemic plans. Pandemic preparedness is like taking out an insurance policy against future crises. But insurance comes at a cost, and all of us grapple with this. In good times, often people will say, why are we spending so much on insurance? It's so expensive. What a waste of money. But when the crisis comes, everyone says, why didn't we buy enough insurance? That's always a human tendency. How do we strike the balance? There are no easy answers. The CDA must find a careful balance between preparedness and sustainability of resources. But one of the keys in answering this question is recognizing that the balance is not static. It is a dynamic one. And that means we have to stay alert to emerging risk. And when we see threats building up, we are able to ramp up our buffers and defenses. And being beyond plans on paper, the CDA and its partners will also have to keep our systems warm through regular exercises and simulations. When people trust that the authorities are communicating truthfully and transparently, they will rally behind public health measures. Conversely, when there is no trust, misinformation spreads and there is no unified response. So the CDA must be a trusted and authoritative source of accurate, clear, and timely information to help Singaporeans stay safe and be informed. Beyond pandemics, the CDA will also play an essential role in strengthening our resilience against endemic diseases that we constantly face. It will tackle important topics such as slowing the development of drug-resistant germs, improving infection prevention and control, and advancing scientific research to protect public health. Vernon, CDA CEO, brings deep experience. He played key roles in managing SARS, the 2009 influenza pandemic, and the 2016 Zika outbreak. He was the Director of Communicable Diseases at MOH during COVID, and his experience and expertise proved invaluable support when Yikang and I co-chaired the COVID Multi-Ministry Task Force. Kenneth is Chairman of the Board of CDA. He became Director of Medical Services shortly before COVID hit and had to hit the ground running. His steady and calm leadership and his ability to explain complex health issues clearly were crucial to building public confidence and trust throughout the pandemic. We have a good public service, but even so, the CDA and the government cannot fight the next pandemic alone. COVID showed us that pandemics are not just public health issues. They can significantly impact our economy, our society, and the daily lives of every Singaporean. It took every sector of society to fight COVID. Healthcare professionals on the front lines, public officials implementing border controls and safe management measures, enterprises implementing business continuity plans, pivoting their operations and keeping workplaces safe, and community groups mobilizing volunteers to care for the elderly and vulnerable. When the next crisis comes, and it will come when the next pandemic strikes, the government cannot act alone. We will once again need the full support and participation of every Singaporean to stay vigilant, to act responsibly, and to stand together. Only by working together as one united Singapore can we overcome the next pandemic.